Healthcare workers and the elderly will be some of the first to receive the COVID-19 vaccine.
ABC 6 News Good Morning reporter Samantha Boring spoke with a Mayo Clinic employee who says he plans to get the vaccine and has more than just his job as a reason to do so. Good morning, Samantha.
Good morning, Rachel and Brianna. Andy Herbert is a father of 3 and a physician assistant at Mayo Clinic. But even before the pandemic began, he and his family have been living a life that's been centered around staying healthy.
I don't take viruses lightly. I've learned that. I almost lost my son to RSV.
These last few years have been a whirlwind for Andy Herbert and his family. His son Nathan was diagnosed with cancer in 2018. Nathan is now close to finishing chemo, but his journey hasn't been easy.
I've seen mechanical ventilators. I've seen oscillators. I've seen ECMO.
Wearing a mask and living a more isolated life has been a vital part of keeping Nathan healthy. Andy has also worked at Mayo Clinic for 15 years, now helping treat patients with COVID.
We usually have about 15 medicine services that we're responsible for, that we cover patients. And when the pandemic came around, that's rapidly increased.
Now that a vaccine is being distributed nationwide, Andy will be one of the first to receive the shot.
There's zero doubt in my mind about getting this vaccine. The way that I kind of look at it is you either can get the vaccine or you're probably going to end up getting COVID.
He knows it may be hard for some to decide whether or not to get it.
I notice there's a lot of hesitancy out there, and I would strongly suggest that people invest time into, real vetted resources, infectious disease specialists, CDC, the NIH, not social media comment sections.
And if you do not know who to turn to,
find a favorite expert that you trust or rely on.
He says there are a lot of things behind the cases we do not always see.
People focus on case numbers and they focus on death, but they're not realizing the amount of morbidity that happens.
To him, if we can follow the CDC guidelines and take care of each other, this vaccine can help slow the spread.
If we can hang in there and, don't overwhelm the hospitals, let us take care of the patients that get it, and then let us kind of vaccinate people according to the plans.
Andy says something else to think about is we will most likely still need to wear masks and practice social distancing for a few months after getting the vaccine. Andy tells me that next week is when they will start to receive vaccinations. We'll continue to follow Andy and the rest of the Herbert family and bring you updates on their progress.